I'm Alina, your insurance jockey, and today we're going to talk about the 5 positive facts about Original Medicare. Please make sure you like and subscribe to my channel so you don't miss anything. The transition to Medicare is a wonderful opportunity to enjoy healthcare benefits when you are 65 and older or have a disability or medical conditions that provide you with coverage. To help you learn more about this program and prepare you for enrollment, here are the 5 positive facts about Original Medicare that you may enjoy discovering. You can access Original Medicare healthcare benefits throughout the United States and its territories. If you have Original Medicare, medical coverage is available in all 50 states and the District of Columbia, and in its inhabited territories. This includes the American Samoa, Guam, the Northern Mariana Islands, Puerto Rico, and the U.S. Virgin Islands. In the event that you require medical care while traveling, it's important to know that most doctors and hospitals accept Original Medicare within these areas. If you're outside of the United States, you may not get the same coverage. Original Medicare typically doesn't cover any medical treatment you receive while outside of the U.S. There are some exceptions to this rule. However, it's always best to obtain a travel insurance policy meant for traveling abroad. Please contact me for prices and info, as these policies are a lot more affordable than you might think. You do not need referrals for covered services under Original Medicare. One of the biggest benefits that come with Original Medicare coverage is that there is no need for referrals. Since Original Medicare encompasses Part A, which is hospitalization coverage, and Part B, which is outpatient medical coverage, beneficiaries can select any doctor that accepts Medicare for their treatment needs. Therefore, under your Original Medicare plan, you're free to select the doctors and specialists you consult with at the hospital or healthcare facility of your choice. As long as selected practitioner accepts Medicare, you are all good to go. Beneficiaries can select and change Medicare benefits every year. There are 2 annual enrollment periods where Medicare beneficiaries can change their benefits. The annual enrollment period, or AEP, and the open enrollment period, OEP. During the AEP, which runs from October 15th to December 7th, Medicare beneficiaries can change from Original Medicare to a Medicare Advantage plan, change from a Medicare Advantage plan to Original Medicare, change from one Medicare Advantage plan to another, enroll in Part D prescription drug coverage, change from one D prescription drug plan to another, and cancel their current Part D coverage. Any changes made during AEP will take effect on January 1st of the next calendar year. OEP, on the other hand, is a little bit different. The Medicare Advantage open enrollment period, which applies to those currently enrolled in a Medicare Advantage plan. This runs from January 1st through March 31st. During OEP, Medicare beneficiaries can enroll in a new Medicare Advantage plan with or without prescription drug coverage. You can disenroll from a Medicare Advantage plan and return back to Original Medicare and enroll in a standalone prescription drug plan. Medicare allows coverage adjustments when major life events occur. In addition to AEP and OEP, Medicare also includes a special enrollment period, or SEP. That allows beneficiaries to delay initial enrollment in Parts B and D without incurring a late enrollment penalty, or change coverage outside of a designated enrollment periods without incurring penalties or gaps in coverage. Special circumstances that allow for an SEP include loss of employer coverage, moving out of your Medicare plan service area, residing or moving in and out of a skilled nursing facility, losing or gaining eligibility for Medicaid coverage, which is your low-income or state assistance program. In these situations, an SEP grants delayed enrollment without penalty or Medicare coverage changes to assist beneficiaries in enrolling and managing their Medicare benefits. Now, documentations of said circumstances is required to create the special enrollment period. It is highly recommended that you verify your eligibility for an SEP beforehand. Medicare can be less expensive than previous health care coverage. You could save a lot of money by enrolling in Medicare. If you are working past 65 for a large employer, which large employer is over 20 employees, Medicare costs, premiums, deductibles, and copays, also coinsurance, can oftentimes be less than many employers anticipate. It is important to carefully compare your current plan premium, deductibles, and maximum out-of-pocket costs to get an accurate assessment of both options. For most, Medicare Part A is premium-free due to paying taxes while you are working. However, Part B requires a monthly premium. This cost can increase with your income. Understanding the Part B surcharge, known as Income-Related Monthly Adjustment Amount, or IRMA, is important since added costs to your premium can be quite a shock. Now, you can appeal IRMA to lower these costs. I highly suggest you reach out to me to help with that appeal process. For out-of-pocket costs, Medicare Part B has a very low deductible of $240 for 2024, and the coinsurance after this is just 20% for the Medicare beneficiary. However, it is important to note that Medicare Parts A and B do not have an out-of-pocket maximum limit, so considering a Medicare supplement plan can be helpful in covering your exposure to claims. Even without an out-of-pocket maximum, Medicare is still a cost-effective choice that can offer beneficiaries savings when compared to large employer-sponsored health coverage plans. If you need individualized assistance with your transition to Medicare or to a different plan, such as a Medicare Advantage or Part D prescription drug plan, you're in the right place. Contact me, Alina Marchant, today, and I offer a one-on-one first step in exploring all of your options into Medicare. Scheduling for me is very easy. My Calendly link is in the description below. You can always visit me at mpgroup.org.